Allergies and colds are common ailments that affect the respiratory system but stem from different causes. Allergy symptoms triggered by an immune response to environmental allergens like pollen or dust often include sneezing, itching, and a runny or stuffy nose, while eyes may water and itch. In contrast, cold symptoms are caused by viruses and typically involve sore throat, coughing, and a runny or stuffy nose, with the potential for body aches and fever, which are rare in allergies. While allergies are treated with antihistamines, decongestants, and nasal corticosteroids, colds usually require rest, hydration, and over the counter remedies to alleviate symptoms. Those with a history of allergies or a weakened immune system may be more susceptible to either condition. Here's a detailed look at the distinct aspects of allergies and colds, their impacts, and management strategies. Causative agents, allergens versus viruses. Telling allergies apart from a cold can be tricky, as both present with sneeze-worthy symptoms. Yet the devil is in the details. Allergens are the mischief makers in allergies, inciting the immune system to overreact to harmless substances like pollen or pet dander. Histamines flood your system, leading to itchy eyes, sneezing, and a runny nose. Colds, on the other hand, are caused by viruses, the most notorious of which is the rhinovirus. These infectious culprits invade the respiratory system, causing symptoms like a sore throat, coughing, and yes, sneezes too. But here's the catch. Colds often bring with them body aches and fever, which allergies do not, and a cold will run its course in about a week. Allergies stick around as long as you're exposed to the allergen, with repeated, seasonal, or persistent nuisances based on what your immune system mistakes as a threat. Symptom onset, gradual versus sudden. Understanding the difference between allergies and colds can be perplexing as symptoms often overlap. A telling sign lies in their onset. Allergies tend to begin almost immediately upon exposure to an allergen. For instance, stepping into a dusty room could trigger sneezing or itching within minutes. Conversely, the common cold usually announces itself with a slow escalation over a day or two. This gradual increase of symptoms, such as a sore throat, followed by sneezing and congestion, indicates the body's ramping up an immune response to a viral infection, whereas the immediacy of allergy symptoms reflects a direct histamine-mediated reaction. Duration of symptoms, persistent versus temporary. Allergies and colds can often present with similar symptoms such as a runny nose, sneezing, and congestion. However, a key factor distinguishing them is the duration and persistence of those symptoms. Allergies, triggered by exposure to allergens like pollen or pet dander, can last as long as the exposure continues, potentially leading to chronic conditions. In contrast, colds, caused by viral infections, usually resolve on their own within a week or two. While allergy symptoms can recur regularly and predictably in certain environments or seasons, cold symptoms are more sporadic and typically are accompanied by general malaise and sometimes fever, which are not typical features of allergies. Recognizing these patterns can help differentiate between the two and guide appropriate treatment, such as antihistamines for allergies or rest and fluids for a cold. Associated discomfort, itching versus aching. When differentiating between allergies and the common cold based on associated discomfort, itching is a hallmark sign of allergies. This itching can manifest in various ways, such as itchy eyes, nose, throat, or skin, indicating an allergic reaction as the immune system responds to a benign substance as if it were harmful. Conversely, cold symptoms typically involve aching, which includes muscle soreness, headaches, and a general feeling of malaise. These aches stem from the body's fight against the viral infection causing the cold. Recognizing whether discomfort is characterized by itching or aching can steer a healthcare provider toward the appropriate diagnosis and subsequent treatment. Seasonal occurrence, seasonal versus year-round. Allergies and colds frequently confuse patients and healthcare providers alike due to their overlapping symptoms, such as sneezing, coughing, and a runny nose. However, the timing and cadence of these ailments can be distinguishing factors. Seasonal allergies flare up during specific times of the year, commonly in spring and fall when pollen counts are high. In contrast, colds are more prevalent in the winter, but can occur year-round, especially in close contact environments. Allergies often persist for longer periods, as long as the individual is exposed to the allergen, while colds typically resolve within 1 to 2 weeks. Observing symptom duration alongside seasonal patterns can assist in reaching an accurate diagnosis and appropriate treatment.